I'm joined by Dr. Casey Harbine for another edition of Morning Rounds. Thanks for waking up with us today.
Yeah, you bet.
We have a timely topic as we head back to school, all of our kids. Head lice, the topic for today. Back to school, it does seem to bring lice, and why is that?
Well, I'm sure it has nothing to do with the fact that September is National Pediculosis Month, or Head Lice Month, but what happens is kids start getting back together and we start seeing lice.
What exactly are head lice?
So head lice are parasitic insects, so they feast on human blood, and they live in the scalp, near the hair, the neck, things like that.
Who's at risk then?
Well, kids seem to be primarily at risk, but pretty much all of us. It has absolutely nothing to do with our hygiene, how clean we are, how tidy we are. Kids, because they probably are more in close proximity to each other, lice crawl, they don't jump. So you really have to have head-to-head contact lots of times, and that more often happens when you're younger than when you're older. And then anyone who has kids are at risk.
So that kind of ties into the next question about how we get it.
Right. So they have to crawl. They can't hop. They don't fly. So from me to you, you won't catch my lice today.
Oh, okay. Good.
Typically, they don't survive off the human body for very long. So there's this fear that, shared clothing or things like this, it doesn't happen that commonly. They can't grasp onto things very well. Sometimes maybe if you lay on a pillow at school and the next kid lays on the pillow, that could happen.
Okay, so what happens when infected?
So when you're infected, the lice are in three forms. One is the active adult louse. That is the insect bug that you can see crawling. They lay eggs, and the eggs are laid very close to the scalp, and those eggs are called nits. And then the nits hatch sometime in the 7, 8, 9 days, and those are immature louse.
Okay.
They can irritate the skin. They can cause a skin reaction. You can scratch your head because they're so irritating and tickling. They do not spread disease from one person to another.
We kind of already talked about it, so how is it spread then?
Well, so, pretty much from head-to-head contact. I suppose if you were sharing a brush and you used it right away, but really the lice don't survive for very long off the human body. There's this fear that maybe if you're at the hub and you're sharing helmets and things like that, but they can't grab on to very smooth surfaces.
So what do you do if your kids do get head lice?
Well, pretty much you need to use an over-the-counter treatment is probably the best thing to do. These are shampoo type things. They usually involve a comb. The comb is so you can comb out the nits. The nits get cemented to the hair shaft, and they can be really difficult to get out. Most of these treatments really don't kill the nits. They mostly kill the lice, so you often have to retreat after 7, 8, 9 days to get the next set. Using things like conditioners and stuff like that can actually make the treatment less effective. So that's not recommended. You don't want to wash your hair again in 1 to 2 days. Washing bedclothes and things like that is helpful, that the infected person is touched. Not everyone in the family has to be treated unless there's one person who's sharing the bed with the infected person. And things that can't be washed in a hot cycle or dry cleaned, like a stuffed animal or a favorite blanket or something, they can be actually put inside a plastic bag for 2 days and nothing will be alive after that.
Okay, so do any household remedies work?
So sometimes people have used things like mayonnaise, butter, oil. The idea is to kind of suffocate the lice. There's no scientific evidence to support that works. So,
are there any side effects to the treatments you may use?
The over-the-counter treatments are pretty mild. The recommendation is really that you just do it once, twice, maybe 3 times over a period of a week and a half. If you haven't seen an effect, using it more frequently might cause troubles. You don't want it can cause some skin irritation and things like that, but they're usually pretty mild. And if those aren't working, then you probably need to see your family doctor.
So is it necessary then with these treatments to remove all the nits?
It is not. And in fact, once the nits get more than a 1/4 inch away from the scalp, they're really not viable and they won't hatch. There's this fear because you see them and they're white, and so especially if you have dark hair, but once they kind of grow out of the hair, because they're so difficult to remove, you might still see them, but they're not viable and they won't hatch into active lice.
And do you need to treat your pets?
So no, pets don't get infected. Whatever kind of lice the pets get, humans and pets don't share it.
Okay, well, thank you for all these tips this morning. And if you have any questions that you would like us to answer, you can email them to us, morningrounds@kpax.com.